So now let's talk about part 2 of the Advanced Healthcare Directive, Instructions for Healthcare, otherwise known as your living will. Now you've already clarified your goals and you've already chosen a healthcare agent or surrogate. So now it's time to translate your wishes into practical guidelines or the so-called living will. This section of the Advanced Healthcare Directive is actually not mandatory, since the agent you already selected has the authority to carry out your wishes. However, many people, in fact most people, choose to fill it out as a guiding light for their healthcare agent and also to help their medical team. The first section of the living will gives you 2 common scenarios: a choice not to prolong life or a choice to attempt to prolong life. As we've already discussed in other videos, you know your current health status and you've thought about your desired goals for care. This section pushes you a little further. What happens if your health status suddenly changes? What if you get into a devastating car accident or suffer a massive stroke or even a heart attack? What if you are likely to die within a short time and organ-sustaining treatments at best delay but not prevent your death? Maybe you've suffered severe brain damage, are in a coma, for which you are not expected to recover. It is possible that well-intentioned treatments could actually cause more harm than good. Sadly, that is often the case. CPR is in fact a good example of that, and many people misunderstand the basic information about CPR, or you might have heard of it called code blue or cardiopulmonary resuscitation. So let's start at the beginning. What is CPR? CPR is a treatment that can be attempted to restart your heart and lungs if your heart and your lungs and your breathing stop and you become unconscious. When paramedics or hospitals perform CPR, they repeatedly push on your chest to squeeze blood out of your heart, and they often use a plastic mask over your mouth and nose to move air in and out of your lungs. In addition, they often use an electrical defibrillator. What's an electrical defibrillator? Well, it's a machine that delivers an electric shock to the heart in an attempt to restore a normal heart rhythm. Now, you may have seen in the movies or on television that CPR seems like a very successful type of procedure. In fact, one medical study of TV dramas showed that almost 75 to 80% had success when doing CPR. Unfortunately, in real life, reality is not the same. Another study found that when CPR was attempted in a hospital setting, one where people actually know how to do CPR, no more than about 20% of patients survived through discharge. And that's the best case scenario. Let's look outside of the hospital. Let's say in your home or in the community setting. The success rate of CPR is even worse. Another medical study showed that patients who were over the age of 75 years old, who had multiple chronic illnesses and frailty, showed that the number of survivors of CPR in the outpatient setting was less than 3% or 1% and approached 0. Therefore, CPR itself can cause injuries which are significant to your body and offer very little help. Ribs can be broken, lungs can be punctured, and serious trauma can be caused to your windpipe. So in the end, the success of CPR depends on a number of factors, including the patient's overall health, the patient's disease burden, and why the patient went into cardiac arrest in the first place. It also depends on how long after cardiac arrest started that CPR began. Studies have shown that patients with terminal illness suffer much greater harm than they get benefit from CPR. This is very different than the statistics that you saw on television, or 75 or 80%. it's closer to under 5%. Now, because of these statistics, many patients who initially requested CPR changed their minds once they are informed of the realities of what CPR actually means. But beyond CPR, other life-sustaining treatments include artificial nutrition and hydration, as we spoke earlier, fluids and food, hemodialysis or an artificial kidney, and artificial ventilation, where a machine pushes air into a person's lungs. These procedures are often called life-sustaining, organ-sustaining treatments. And while under certain circumstances, these kind of treatments can be an important bridge to meaningful recovery, unfortunately, more often than not, they merely postpone death without enhancing meaningful life. These organ-sustaining treatments may not be right for you, and unless you tell us and speak with your doctors, we may never know what your wishes for treatment are. Now, too often in real emergencies, medical teams have absolutely no knowledge of what you, the patient, wishes. If we do not know or are unsure, then these procedures begin immediately. So it's so important for you to make your choice and give us the guidance we need to serve you best. Now, tonight, it's the time to think about these choices, not when you're in an ambulance racing to the emergency room. The next section of the form talks about pain relief and other wishes for your care. Parts 3 and 4 are actually optional. Part 3 asks if you wish to be an organ donor, which is exactly the same question you've been asked when renewing your driver's license at the DMV. Frankly, there's no right answer for this question. It's whatever you feel is appropriate for you. And Part 4 allows you to name your primary care physician. In general, completing this section, in my opinion, is a great idea. Hopefully, you've gotten to know your primary care physician, either your family doctor, your internist, or even your gynecologist. And in an emergency setting, these doctors can be called upon to promote previously selected wishes and goals and best interests which you have told them.